Hey everybody, Dr. Mark here. I am super excited. We got Dr. Trevor Colm that's going to be discussing with us today. Should chiropractors be brain doctors? Is that what we should be educating the public that we are? So I'm super excited. Dr. Trevor, please introduce yourself, any pertinent background, and give us your idea.
Okay, I practiced for 10 years. No longer in practice. I stopped practicing about 6 months ago. The last 5 years, I've been developing a new technology for chiropractors, but it has a lot of other applications. It's basically a real time brain scanning device that we can use during an adjustment, as well as to track patient progress and things like that. So think of it in terms of sort of like the next generation version of a subluxation station or something like that, where we're actually going straight to the source and measuring the tone of the nervous system directly. So that's what I've been up to for the last few years. And, along with that, I often get asked, like, how do we use this? How do we communicate it? Right. How do I, I've been a subluxation based doctor. How would I implement a brain scan in my office? And so this is kind of, so my vantage point here is that, I had a brain injury and that's how I got into chiropractic. And, I lost my short-term memory. Nothing was changing for months. I go see a chiropractor, boom, lights on, my whole life changed. And so for me, chiropractic was always like, we're changing the brain, right? And so this is where I'll start. So when we have a vertebral subluxation, there's really three. I'm gonna speak very high level here. There's three things that happen, right? We have changes at the vertebrae, like the joint, the segment, right? We also and the nerve root. We also have changes that occur downstream along the peripheral nerve, and then we have changes that happen upstream in an altered brain state. And so my position is that we as chiropractors, I don't think we need to change what we do, but the patient facing messaging we use, I think needs to be updated. And so when we communicate to a patient, the value of like vertebral subluxation correction, right? One thing we're doing here is we're putting their awareness on their spine, that the region that we sort of point to on x-ray or service cmg or palpation or whatever it is we use as a sort of tool to sort of educate the patient on here's the problem. Their awareness goes to the spine, right? And where I see a problem with that is that if you extrapolate the changes that occur by focusing on that area, really you're limited to, in terms of the patient's awareness, is better range of motion, less pain, less tension, right? And so,
Well, I would disagree, but keep on going.
okay, but when you move the conversation, you move their awareness to their brain, then they really start to see, like, to me, this is where the magic is, right? Because, I think you and I, we've spoken off camera before, and we largely agree on the sort of non-therapeutic model of chiropractic. And so when we move their focus to the brain, then they can start noticing, wow, like I'm in a better mood, I'm making better choices, and my relationships are improving, and they start to see a larger number of things shifting in their lives because their awareness is on their brain, and they're able to, they're looking at it through an entirely different lens. And if we look at the changes that occur, at the segmental level, at the spinal level, and downstream, it's insignificant compared to how much it alters the brain state. And altering the brain state is really what explains what we do. Like, I had a patient in practice. I'm sure you've seen miracles in your office too, Dr. Mark. She came into my office. She was having a ton of seizures. She lost all the hair on her head, chronic pain, right? And after the first month, she's out of pain. Second month, her seizures stop. Third month, her hair starts to regrow, right? And so, like, what bone would I have to adjust to make those things happen? Like, that that doesn't explain what's happening, right? But when we look at it from, we're changing the brain, that starts to explain some of the miracles we see in our office.
Okay, and
And
so what are you measuring? When you
with what
say
kind?
we're measuring the brain, what are you measuring?
Yeah, so we're using EEG primarily. We also have an HRV component, so we're looking at the heart rate variability. So that's basically the vagus nerve. But the bulk of the device is EEG. So we're literally looking at the tiny electrical signals occurring in the brain. This is the most direct way to measure the tone of the nervous system.
Okay, so if we don't know what innate normal is, what is it that we're measuring?
So, okay, so we do know what innate normal is. So, innate normal, and this is what BJ was trying to describe, it's a state of coherence, right? So, if we think of the body as just a collection of waves, simply put, right? It's how synced up are these waves, right? Are these waves flowing together in harmony or are they in like chaos, right? And so, innate normal, like if you're holding a newborn baby that arguably is, if it's healthy, that's the most pure expression of innate, right? There's assuming it was a relatively normal birth, there's a reason we love holding babies because they radiate coherent energy. And that is the natural state of a human being. And so it's all the stressors, right? Thoughts, traumas, and toxins that accumulate in the nervous system over time that move us away from coherence and create dissonance in the nervous system. So when innate is most powerful, it's when we're in the most coherent state. And so we're
And how
really
do you
trying to
determine when you say innate is most powerful? How are you determining that?
I mean, really, everything in quantum physics now is pointing toward a coherent model, right? Like unified string theory and all this stuff. We're looking at a state of coherence. We're in this coherent field of energy, right, around us. Like what the ocean is to a fish, right? It's like the medium that it's soaked in, right? You call this universal intelligence um, or the quantum field, which is what the ocean is to a fish, the quantum field is to us, right? We're in this sea of energy, and when we are in a state of coherence, we're in alignment with universal intelligence or the quantum field.
Okay, so how do you define chiropractic?
How do I define chiropractic?
Yeah.
Um, I mean, at the most simplistic level, right? Chiropractic is designed to bring a person back to wholeness, right? We have this concept of a subluxation, which is a deviation from wholeness, right? It creates interference throughout the system. A whole host of things happen. And our goal as a chiropractor is to restore this back to a natural state. And so that's I mean, chiropractic, you can take it so many different directions, unfortunately. But I very much subscribe to more of what like Didi was saying in terms of the chiropractic approach, right? The idea of we're removing interference from the nervous system so that it can do its job best, right?
All right, all right. So this is what I throw this at you because I know you're a sincere guy, and this is coming completely from NTC, the non-therapeutic model. So if we define chiropractic, based on the 33 principles of chiropractic basic science, that chiropractic is the analysis and the facilitation of the adjustment of vertebral subluxations because they, in and of themselves, are detrimental to the expression of innate impulses and trophic impulses. And chiropractic is all education toward this objective, and chiropractic is nothing else. So in this definition, we've narrowed chiropractic down exclusively to the vertebral subluxation. Now, with that, the vertebral subluxation is the entity that we deal with that's interfering with the expression of the metaphysical component at the interface where the innate impulse and trophic impulse that are flowing over the physical nerve tissue, whether it's brain, spinal cord, or nerve root. And on the big picture, because we are talking about interference to a metaphysical component, and because we are talking about that interference occurring on the physical matter of the brain, spinal cord, and nerve root, chiropractic is a big picture service in regards to the NTC focus. So, of course, you could have differences in any matter from the brain to the body. And in the non-therapeutic model, we're not focused on results ever. We're focused on result. The only result that the NTC chiropractor is looking for is the adjustment of vertebral subluxations for a fuller expression of innate impulses, or you could say life. So, and I think this is where chiropractors have really struggled, not only having a congruent message, but simply saying that, yes, chiropractic is about addressing the entity of vertebral subluxations, totally disassociating from the outcome. Because what we can logically say through the 33 principles is every human being lives better through the adjustment of vertebral subluxations. Nobody can predict how. And so, what I would say, you could be onto something huge here. Tone, very abstract, not really sure, even from Dee Dee's work to how people use it today. And even Claude Lessard in his, rewriting of Stevenson's chiropractic textbook into 4 and 5 texts, does talk about tone, nerves being too slack or too tight. Not exactly sure where that's going, but I'm open to it. Much like with what you're saying here, where I would disagree is we do not ever know what innate normal is. It's in a constant state of flux. And I would say Dee Dee did a very big disservice trying to narrow down a vertebral subluxation being caused by the 3 T's. I believe it's far greater than that. That Stevenson tried to go a bit deeper, that a vertebral subluxation is a limitation of matter that can be caused when the external invasionary forces overcome the internal adaptive forces, which could happen by any means. So I think that you could be onto something really great here. I would disagree with some of the terminology, obviously, that we can never establish innate normal under any condition for any human being. And even the medical profession is starting to catch up with this by trying to have average ranges.
Yeah,
Um,
I agree with you on that. I think when I say establishing innate normal, we have to keep in mind this is a highly dynamic system, right? So like what is normal in any given moment is changing, right? But as an overarching concept, the concept of coherence, and this is something like Donnie Epstein in the network model has really been working on, is that like we're establishing more coherence in the system. And
Okay, so what does that mean when you say that? Because I don't understand network, and I've had it explained to me for the past 20 years, and it sounds really good. It sounds better than chiropractic. I'm not certain how it fits into chiropractic. What is network, Dr. Trevor? So when you say that this is like network, what is network? When we're talking
well,
about coherence and
I'm not a network practitioner, so I know enough to be dangerous about networks. So I don't want to overspeak there, um,
okay.
but
Because I don't know. I've had it explained, and I could say I don't know any more now than I did 20 years ago what it is.
yeah, it's evolving, right? And I think that's you know I've experienced. I was under a lot of network care for a number of years in my life, and I love the results. And from what I deep dove into about it, it is probably more in alignment with the non therapeutic model of chiropractic than chiropractic. Um, it's
Okay. Oh, how? So what is it? So then what is it?
okay. So it's how do I explain it? Again, I'm not a network practitioner. I know enough to be dangerous, so just bear that in
Okay.
mind.
Sure.
So there's essentially it's an analysis. It's partially an analysis where we're determining dural torque, right? So we're looking at um, so I was a torque release practitioner, which has some of the same roots as network. So we have these dural attachments, right? So we have our spinal cord that floats through a tunnel, the neural canal, right? And it's just
Yes.
kind of floating in there in cerebral spinal fluid. And so when we have a vertebrae that's, let's say, misaligned, for lack of a better term, and we make an adjustment there, we're not really having much effect on the cord itself,
Well,
except
I'm
we
sorry.
have
We're not having what? Could you repeat that? We're not having what, Doc?
we're not having much of an effect on the cord itself from a mechanical standpoint. However, in the cervical spine and the sacrum, there's certain segments where we actually have dural attachments to the inside of the bone.
Yeah,
So
dentate. Yeah, dentate ligaments.
yeah, so we have these sphenoid, occiput all along the foramen magnum. The atlas, they actually attach to the muscles, the suboccipital muscles. So it's more of a dynamic system. Then we have attachments at C2, C5, and then throughout the sacrum and coccyx. And so basically the idea is, what, for lack of a better term, when there's a misalignment or a subluxation in this area, it creates mechanical cord tension. So we literally put tension on the spinal cord itself. And so the meninges, or the dural system, it acts kind of like so it's piezoelectric, which means if there is a mechanical tension on it, just like a guitar string, it changes the frequency that the nerve impulses travel down. And so we're literally creating a mechanical alteration in the frequency of the nerve impulse. And so by using either a force or network, it's more of like a gentle touch. And again, I'm not a network practitioner. With torque release, we put a little force in. Network, it's more of a touch. But we're creating some sort of an awareness or a stimulation to the system at that location, where the body can then self-correct.
Okay. And I did see research that they're finding more dentate ligaments throughout the spine, which I thought was very interesting. And, there are many theories because the vertebral subluxation has such a metaphysical component. And now I'm not saying you're only talking about vertebral subluxations, but I'm going to say a vertebral subluxation is exclusive to chiropractic. And so that's what I'm talking about. That you have so many different theories. Yes, there's cord pressure. And Reggie Gold talked about this, SOT, and they're finding more dentate ligaments. So the brain and spinal cord, because as we know, when you have twisting of the meninges, it's putting pressure on a confined fluid. And just like you're saying, part of the vertebral subluxation, huge part, is that the axoplasmic flow, the transmission, the frequency of the information is not getting to the periphery on time, and therefore that adaptive process does not happen. So yeah, I see the similarities there. And then the argument that we would have in the NTC model, the chiropractor does not make the adjustment ever, because the chiropractor never knows what innate normal is. The best that a chiropractor can do is educatedly introduce a force based on analysis that the innate law takes that force, if everything goes as we intend it, and takes it and transitions that force to an innate force, thus adjusting the vertebrae back to its innate normal position, and then using our post analysis to make sure that that has happened. So all analysis have one thing in common, and that one thing is trying to figure out what the innate law of living things is trying to do within the matter it resides for that vertebral subluxation. And then that's the pre-check, and so the pre-check, it determines the presence of the vertebral subluxation, the vector in which the innate law is trying to make the adjustment. Therefore, the chiropractor makes the educated external concussion of force, allowing the body the ability to take that, and the innate law changing it, of course, to an innate force to make the adjustment. And then the analysis determines that a vertebral subluxation has been adjusted. So go ahead.
Yeah. So so after I'd been receiving a lot of network care, I switched back to more like structural chiropractic, right? And this is, you know, more forceful adjustments. And so what ended up happening is, every time I'd get adjusted, right, the chiropractor would do the pre and post check, everything would look good, but I kept getting sicker. And I ended up getting a brain scan out in California from Dr. Daniel Amen. And what he found was, like, my brain was in crazy fight or flight disarray. And that's when I discovered torque release. And it was through torque release care that, like, my entire physiology changed. And so I do think we understand more. This might be another area we disagree, but I think we understand more about what you're calling innate normal. I do think that we do have a better understanding now, 130 years later, on like what is sort of an optimal state in terms of brain function. And we can put too much force into a system to where we essentially attenuate the entire nervous system. Where if you're doing a leg length check or something, they might balance out, but that doesn't necessarily mean we created an optimal state in the body. And I experienced this firsthand. And so I really do think that this is where technology can really come into play, because the reality is, as chiropractors, we've been practicing blind, right? We have no idea, like you said, we have no idea how this force we put in is affecting the body. We make the assumption that we are improving some aspect of physiology, or that innate intelligence will take that force and rearrange it however it needs to be. But the reality is, it's possible that our thinking's been flawed here. And this is why I think technology is going to be the next wave of chiropractic, to be able to objectively define, like, what is normal for that person, what is optimal for them, and how do we get them there into that like sweet spot without exceeding it, and without not putting enough into the system, because the amount of input we put into that system matters. We can definitely over adjust somebody. And there's a story that anecdotal, but they were doing an upper cervical analysis with a real-time EEG brain scan. And so they touched the atlas, just a skin deep pressure, and you could see the EEG go in total harmony. The nervous system calmed right down. And then they put the force in, and the system went into total chaos. So it was too much force for that person's nervous system to handle. And so I noticed this clinically in my office with torque release, especially patients who had like, and I didn't fully practice in the non-therapeutic model. I was, 3/4 of the way there, but I did find that there were people who had more like severe conditions, like autoimmune things, where they just couldn't handle the same level of force as somebody who's, a little more well. And so that's where I think technology can really help make us better practitioners. Like, we've all probably had, I'm sure yourself, there's probably top 3 adjustments you've had in your life that you distinctly remember, like, man, that was a powerful adjustment, right? And we want to create a scenario where every chiropractor can deliver that level of adjustment every single visit, like predictably.
Now, I am totally for technology. I think we have some absolute terms in chiropractic that we may disagree upon. An adjustment is an absolute term. Either it's adjusted or it's not. So there is no such thing as over adjusting. Either it's subluxated, the vertebra subluxated, and an adjustment occurred, or it didn't, or the vertebra is not subluxated. The technology, this could be amazing. Will we ever know normal, innate normal? Absolutely not. But right now, what you're working with, which is totally fine, is the speculation of this is what we think. And then on the other side of it, a chiropractor, as well as any human, can never feel whether they had an adjustment or not. There is no clinical presentation of a vertebral subluxation. It's exclusively the analysis of the chiropractor, because as you say, this body is so complicated, we cannot correlate a vertebral subluxation to any physiological outcome, whether we're working with a nerve root theory of interference or the brain and spinal cord. The body is so very complicated. What we can absolutely say with absolute certainty is that you do not want interference to the expression of innate entropic impulses. So where I would say we're not nerve system doctors, we're not brain doctors, we are vertebral subluxation doctors that work with a metaphysical component, that we're the only real profession that actually studies this law of life, as BJ would call it, this innate law of living things. When I ask other professions, they dismiss it and write it off. And they're helping people, and they're getting results that are therapeutic. And when we look at results chiropractically, we now have taken chiropractic into the realm of physical medicine and out of the realm of non-therapeutic straight chiropractic, exclusively adjusting vertebral subluxation for a fuller expression of life. Because now, once we're contingent on relating the vertebral subluxation to any physiological outcome, we've now crossed the line into medicine, and we cannot predict that outcome because everybody will always be different. And I'm not dismissing what you're saying, because I think you may be onto something here, Trev. What I am saying that right now, in our terminology, we're speaking different languages when we're talking therapeutic to non-therapeutic. And I know you're a sincere, amazing guy. With NTC, you're either in it or you're not, or you're in the therapeutic model, which still is fine. There's just going to be a whole different standard and a whole different philosophy, which makes it a whole different profession.
I don't disagree with you there. And so let's so I always try and apply things from deductive first principles standpoint. And so
Yes.
I think ultimately we're both sort of posing a sort of our side our sort of side of the argument, if you will. But that side
Okay,
of the
sure.
argument is really the answer to a question, right? And so the question I am answering is probably different from the question you are answering. And I think it's important to maybe define that because
Okay. All right. So what is the question then?
so for me the question is how do we get so what I really so BJ's big idea, right? We talk about essentially having the world adjusted, right? Better expression of life at scale, right? This is, and I'm paraphrasing grossly here, but that
Fine.
concept of the world is a better place if everyone's adjusted, right? In my opinion, we make the
Okay.
we have the power to do that as chiropractors. And so the question I'm trying to ask is how or answer is how do we get there? Like how do we get
Yeah.
chiropractic to mass scale, right? Like I don't and a lot of chiropractors will probably want to throw a green book at me or maybe even shoot me for this, but like I care far more about the outcome of getting the essence of the like what occurs after an adjustment in that person's from my vantage point brain, their metaphysical system, however we want to look at it, right? The outcome
Right.
of that, which I would define as a more coherent system that is more that person is more whole and they're more connected with God and the world around them. And so the goal for me, it's how do we get the world globally, like at scale, to that place? Like I care more about the outcome of that than I do calling it chiropractic. That's my vantage point. And again, I'm not saying I'm right. That's where I'm coming from because I want my children to grow up in a world where like every problem in the world comes back to one thing, right? Human beings, right? And the reality is like it's not all human beings, but it's human beings who are not operating, they're not expressing life at their fullest potential. At the most simplest standpoint, like that's really you could really define like sum it down to that. And if we could be the solution to that at scale, well then we fundamentally change the world. And I think BJ was kind of alluding to that concept in the big idea. And so for me it's like how do we get there? And I think to get there, we need a different patient facing message, right? I think we've tried the vertebral subluxation and model, and people aren't really buying it. From my people aren't Googling vertebral subluxation, but they are Googling brain health. And so, well, I'm not saying what I'm saying is perfect, right? The model I'm proposing is it's not perfect. Like I think I'm trying to become less wrong every day. And so I think when we need to create a communication system around what we're doing that stays true to our roots without, there's obviously going to have to be some compromise there, but we want to maintain true to our roots, which I believe that the non-therapeutic model is the answer. But I think we need to evolve the way we communicate that to people to where they go, oh yeah, I want that. My whole family needs that, and we need that for the rest of our lives. Like when we can just say the thing that makes them say that and go, I need that. That to me, that is what we're looking to do. That's from my standpoint.
And I'm definitely not questioning your sincerity, and I love your passion, Doc. So there's no doubt about it. I would say that we still have to have the means congruent with the basic science of chiropractic. And I would argue that chiropractors have never been congruent in their message. I love BJ, and BJ never left the medical model. BJ was about getting sick people well, and that's unfortunate because it confuses the message at best. So Reggie refined that, as you know, in the 60s and 70s. The model within chiropractic has never took off because there are chiropractors who love being in physical medicine, love the idea of getting sick people well, and do not want to leave it. And I think that has been the biggest, most confusing message in chiropractic. I don't think chiropractors can adequately explain the vertebral subluxation because they don't study it enough, and then they dilute chiropractic by trying to incorporate other things, which is understandable because when your intent is to get sick people well, you're going to incorporate those things up to and including prescribing medication, which now is happening from state to state. So, where I would say my argument would be chiropractic needs to have a clear identity, a clear purpose, coming from a clear definition. And the profession has been very resistant to that since its conception. And language evolves, words evolve, just like you said, and our understanding evolves. So, where you're coming from right now, I would say I could see there could be something huge here. And we may be disagreeing on the language, and I probably the more I would find out about it, the more I could shape it to be an NTC message, which I've done with many things. So here's the thing, Doc. I know we've gone over. We're going to continue this because I know you're going to continue on this journey, and I know that you're very sincere in wanting to bring the adjustment of vertebral subluxations to the world. So this is still in growing beginning stages. Let's talk some more. I'm going to be in touch. And also on Facebook, let's continue to go back and forth and schedule another meeting. Is there any place that folks can reach you or get in touch with you to ask you more about what you have going on?
Yeah, you can easily find me on Facebook, LinkedIn. You can also check out our website. It's www.cortexbrain.com. We're not fully to market yet, but we are close. And we're bringing a team of heavyweight people into the mix. And the goal of this is to be the first billion-dollar corporation that supports chiropractic, and ultimately,
I love that. I definitely love that, and that's a game changer too. So we're gonna talk some more, and who knows how much more we can hash out and work together on. I'm excited for it, Doc, and thank you so much for taking the time to talk with
pleasure.
me today.
Pleasure, Mark. Anytime.
Thank you, Trev. We'll be talking soon, brother.
All right, man. Sounds great.
All right, brother. Bye bye.
Bye bye.